Children Love Your Eyes focuses on children's vision health. Optometrists warn against practices leading to vision impairment in kids, such as excessive gadget exposure and applying breast milk to eyes. They emphasize regular eye checkups for early detection.
Do not allow your child to spend too much time on the digital device. Most digital devices, sometimes you can see a child being on the device for more than 3, 4, 5 hours. Then we have what we call the Blu-ray that come from electronic devices. Now, those electronic devices have Blu-rays that come to the eye, especially when they are brought closer. So those exposure, those response relationship with exposure and effect on the eye is very, very high. We discourage putting breast milk into the eye of a child. The breast milk will be a harbinger for infection. When you put breast milk, you are providing a very suitable environment for bacteria and for germs to grow.
Your eye health comes first. Whatever it is, take your eye and eye health seriously and make sure you visit an eye clinic at least once every year.
World Mental Health Day's theme is Time to Prioritize Mental Health in the Workspace. Health experts are highlighting treatment centers and advocating for quality care for those with mental health disorders.
Asham, on behalf of the Coordinating Minister for Health and Social Welfare, go ahead and inaugurate the National Task Force on Decriminalization of Attempted Suicide with the following terms of reference: to carry out constructive and strategic engagements with stakeholders towards ensuring a timely and seamless decriminalization of attempted suicide in Nigeria, to carry out enlightenment campaigns of the public on the merits of decriminalization of attempted suicide in Nigeria.
The workplace no longer be viewed solely as a place for productivity. It's more recognized as an environment that shapes our mental, emotional, psychological well-being. Mental health in the workplace is shared responsibility, one that calls on government, private sector employers, labor unions, civil society to collaborate and foster environments where mental health is not only discussed but prioritized.
These events underscore the importance of vision and mental health care in Nigeria. Olije Wapera, Arise News.
Right, we're joined now in the studio by Dr. Anderson Chimeziri, who is the president of the Nigerian Optometric Association. And in our studios in Lagos is mental health advocate Dr. Taiwo Akinoso. Thank you very much for joining us on a day like this. Let me start with you, Dr. Akinoso, on the issue of mental health, because, I mean, look, everything rises and falls on mental health. Let's talk about the theme for this year, quite interesting: Healthy Minds at Work, prioritizing mental health in the workplace. How important is it to prioritize mental health in the workplace?
Well, the workplace is a very dynamic environment, and so mental health should be held high in the workplace. Workplace, we have employees who come there to have their daily jobs done and also make a daily living, and they become productive to them, their family members, to the organization, and to Nigeria as a whole. And so anything or situations that distorts the mental health of workers in the workplace would most likely lead to low productivity and probably even disasters and errors in the process. And so this year, the theme is important because organizations now need to pay close attention to the mental health of their employees and ensure that at all times they are able to raise the bar in terms of mental health for employees.
Well, I think as you drive that, we'll come back to you to see how much of it you're doing with HRs across Nigeria. They're the ones to also have that kind of conversation to understand how best to deal with employees and staff. Now, let's bring this back to you, Dr. Chimeziri. the eyes.
Yeah.
Now I'm squinting. So,
And we're wearing glasses, come to think of it.
and quite a lot you said in that report, and you also emphasized a kind of practice which some people are really shocked to see that mothers have done over the years, and how that has damaged the sight of young Nigerians. Speak to us more on the importance of the day.
Yeah, thank you very much. Coincidentally, today is World Sight Day and World Mental Day. The eye being the first organ under embryology that was formed. In fact, we believe the brain is an extension of the eye. So it's favorable coincidence that we are talking about the two major organs. If I see a cat and show you and you tell me it's a goat, I would think you're not mentally sound. I mean, something is wrong. So World Sight Day is a day that is set aside to commemorate and to celebrate and to create awareness for eyes. And this year we are, emphasis is on children. We're talking about child eye health, because we say children have longer blind years. If a child is blind at young age, and they're looking at a Nigerian lifespan of 55, that means that child is going to be blind for close to 40, 50 years. And then we also know that assaults at early childhood can affect anybody at adulthood. So we are very careful, because anything about children can have very serious consequences. Also, we know that the young ones are the productive sector of the economy, and anything that affects them will affect production. So when it comes to the eyes, I mentioned the issue of breast milk, which is a common practice, that mothers feel that breast milk is a kind of medicine or a medication that can take care of, but actually breast milk is the nutrition. And if there is bacteria on the eye and you're putting breast milk, you are fortifying the nutrition for the bacteria. And of course, that will escalate and increase and worsen the condition. And also, you don't understand what is the state of the mother, because some of the conditions can be excreted in the breast, So what is the state of the mother? I mean, his health state, which could lead to expressing some of the germs into the eyes. And of course, the sanitation and the hygiene of the breast and the rest of them. So we discourage that. It was in the old times they do that, but studies have shown that it doesn't really improve the situation, rather it worsens. So we discourage that. And then we have also other practices, like we talked about the digital devices. Exposure. So we're talking about what is the onset, one, then the duration, and of course the closeness. Onset in the sense that when it was our time, you get to 6 years before you go to school. But now at the age of 6 months, a child is beginning to get exposed to digital devices. Now, from studies, maturity of vision starts at age 6, meaning that as you're exposing this child to digital devices before age 6, there are consequences that come with it. Then another is the duration, the length of screen time. The more the child is looking at the screen, the pupils, the eyes are well focused. There is limited exercise of the eyes, which could lead to what we call digital strain. And then, of course, the closeness to the eye. And that's why there's a lot of studies going on to show that in the next few decades, half of the population of the world is going to be myopic because of the closeness. In the olden times, when we use our televisions, you see...
Break it down so that they understand what you say, myopic.
Myopic means short-sightedness. That is, you can see something very far. And that is very, very common, because the more the child is exposed to near objects, the more the brain tries to accommodate those objects, and then elongation of the brain, what we call the axial length, leading to myopia. Myopia is when the image is formed before the retina. So that is going to be an epidemic, and though we are working seriously on devices and things that can use to remedy the situation and bring solution to them. So
we'll talk more about those solutions in the course of this conversation. Let me bring back Dr. Taiwo Akinoso. I mean, yes, we're narrowing it down to mental health in the workplace, and the figures are staggering in terms of the impact of neglect, the global economic cost of neglect of mental health at the workplace. $1 trillion in productivity deficit. But let's bring it back home and speak generally about the state of the mental health of the Nigeria, and especially against the backdrop of the economic situations that we find ourselves in, and how people should begin to protect themselves, employees, and of course employers, what they can specifically do to protect employees?
Okay, thank you very much for that question. So currently now, there are a lot of course, there's what we call an economic crisis now. And the information we're passing across to employers is to say that you need to embrace mental health as a whole. And there are solutions out there. And solutions are always tailored to individuals, and there's no one size fits all in all of this mental health advocacy. And so we're telling employers that they should pay attention to their employees by making sure that they have some level of training and awareness in terms of what are the signs and symptoms of mental health, how to identify them, and also to seek help either through therapy sessions or counseling. And this is what we continue to see, that people will go through mental health related events at some point in their life. For us, it's that when they go through this, they are able to overcome those situations, and that they're also open enough to share their experiences and how